So working with our partners, we've identified the most challenging things that they run into, and of course, as a partner with our customers, we try to prevent any of those challenges. But what we've learned is, first of all, there's a change management issue and a change management initiative that must come from the top of the leadership of these organizations, these IDNs and these healthcare systems, to actually put forth the change. Once you've got the change management practice going on and you're working hand in hand with the clinicians to discuss the right type of new clinical workflows that need to be administered and followed, then you've got to deal with the technology challenges. The technology challenges can be all dependent on the network that you serve. Whether you've got populations in rural settings or very urban settings, you've still got to get the technology in the hands of the patient. You've got to educate them on how to use it, how to interact with their caregivers, and of course you've got to do the same thing with the caregivers who are going to be using these solutions. So there's a clinical workflow aspect that has to change first, done through proper change management issues. Then you've got to deal with the technology itself, and then you've got to make sure that the patients are ready and they're the right patients that can take and utilize those services. So we've got a variety of patient types that use our telemonitoring or remote patient monitoring services. You can work with patients who are in a very low acuity, just needing to have a PCP interaction, maybe something their doctor said they didn't quite understand while they were in the office. They just want to do a quick touch point back to the provider and ask a question rather than scheduling a visit, waiting several weeks to come back in and then having that visit. Just a quick face-to-face question and answer type service. All the way to the high acuity spectrum. We focus on COPD patients and CHF patients as a long-term management strategy. We try to implement and get them into settings from 30, 60, or 90-day programs. And of course, the whole goal for us in partnering with our health systems is they can either step up into care post those 90 days programs or step down into an unmanaged care setting. So you have to think about all the different cycles of those that need to be included, the care managers, the physicians, of course the full care team, the patient themselves, and then the setting and the environment they are going into.